Welcome back, everyone. I got another newbie with me.
Yeah.
I do have another newbie with me. I have with me Scott Kerby, and he's the owner of Medicare Guidance Center. Welcome to the show. I want you to tell everybody a little bit about yourself and what you do. You know, a lot of people are listening or of this age group, so tell everybody a little bit about yourself.
Medicare Guidance Center is an organization that I started a couple of years ago because of a need, being a Medicare insurance specialist, to be able to help facilitate the ongoing constant issues that come with doctor's office bills, with all kinds of things that need to be addressed moving forward.
Okay, so when you started this, I'm going to take you away from all of this that we're doing, and I'm going to ask you some questions that are not on here, okay?
Mm-hmm.
So you said that there was a need, a huge need, and that needs that you said are questions and things that people didn't understand. Is that what it was?
Yeah, Medicare in and of itself is very complicated.
Too many alphabets.
So, and it changes. There's a constancy of change. So there's always questions in regards to what do my benefits entail? Is this covered or not? What happens if I go into the hospital? What happens if I need to start to take a new prescription drug? What happens if I need oxygen? What happens if I need transport services like an ambulance? Is there a difference between ground services and air services if I need to go get immediate medical attention? So those are the kinds of things that are just so confusing. And unfortunately, what happens oftentimes is the individual finds out what kind of coverage they have after the fact.
Yeah.
And often the member of the family calls me seeking to be able to get guidance, advice. Is this a covered benefit? Where do we stand financially after this experience? And it becomes just a series of difficult circumstances, oftentimes because they're dealing with the situation at hand, and it could be chronic illness. It could be something as serious as cancer or heart attack or stroke or something like that. So they need to be focused, the individual needs to be focused on getting better, not dealing with all of these other ancillary issues and concerns that come along with questions that need to be answered.
Now, your phone number direct, it's 480-331-5244. You're A+ rated with the Better Business Bureau, also statewide when you work with people. And this is a free service that you offer.
It is. So I'm passionate about the ability to be able to seek guidance on others' behalfs, to be able to help them navigate through this complex system that's just overwhelmingly difficult and not very user-friendly. Now, many people have family members, people that help to be able to help support them, but often there's an individual that's alone, trying to be able to do it on their own.
I'd be one of them. Yeah, there's a lot of them.
Trying to make sense of the situation, trying to make sense of the circumstances, and trying to be able to navigate through everything involved in the process of trying to be able to pay bills and get better.
Sure. And so when you try and make that less complicated for them, how do you do that?
Well, first and foremost, we need to be able to understand the circumstances. And the very difficult part of what it is that we try to be able to do is having a group or a facility or some sort of an entity accept responsibility for what it is that they have done or need to be able to do. For example, an individual may go to the hospital as an inpatient and need care or treatment, okay? They're there for a week or so, and then all of a sudden they just get inundated with bills, okay? So we need to be able to try and understand why that occurred. What are the circumstances? Why didn't the insurance come in and pay what they needed to be able to do? So there's fault oftentimes across the board with all of the different people and groups that are involved in the process. And they don't talk to each other. So the insurance company may have a disposition or accept some sort of responsibility, but the hospital says the insurance company isn't paying them. The insurance company says, well, the hospital didn't submit to us the claim correctly. to be able to get paid. So the hospital seeks to be able to get payment from the patient instead of communicating directly with the insurance company.
So you are the facilitator.
Exactly, to be
Okay.
able to get both parties involved,
Sure.
to be able to say, hey, we've got this issue, we've got this concern, we've got this problem. This person, the patient, needs to focus on getting better.
That phone number to call him, it's 480-331-5244. He's been doing it for 18 years. This is a free service to you, the families out there. So for you, it makes sense, especially if you're dealing with these types of issues, especially. Give him a call and find out what he can do. It's a free consultation. He's going to do do all the work for you, so that you know exactly what's going on in your situation. And everybody's got a different situation. He's statewide. He's A+ rated with the Better Business Bureau. Again, that number is 480-331-5244. Okay, so what can be done about the cost about prescription drugs? Listen up, everyone!
Prescription drug costs. You know, the challenge with prescriptions is that it's an inherent need that the individual oftentimes needs to be able to take just to survive. You know, I think of insulin, for example, for diabetes. I was dealing with an individual here recently who's in remission from cancer, and he has to take a maintenance prescription for the rest of his life. Well, his wife lost the coverage. He doesn't have his group employer plan anymore to be able to offset that, so he had to enroll in Medicare. Part D is what it's called, prescription drug coverage. Well, the cost for his prescription was $555 a month.
Ooh.
For somebody that was just laid off and is unemployed. For all of us, you know,
Right,
that's
I don't
an
care if you have a
extreme
lot of money, that's a
amount,
lot of money.
of money that needs to have to be able to be spent.
Sure.
I tried to advocate for him and was turned down. I was told that if he had Part D plan through Medicare, that he would not qualify to be able to get additional assistance. I went to Johnson & Johnson, the pharmaceutical company, advocated on his behalf, and they came back to us and said that they would cover it 100% to their credit.
The number to call him direct is 480-331-5244. This is why he's A+ rated with the Better Business Bureau. Dental programs, are there some for seniors?
There are, specific to that individual need. I don't want to hear, and I often do, that they had to leave the country to be able to get their dental care.
I know! A lot of
You know,
people are doing that.
What's wrong with that?
The guy behind me, my board operator, I did that.
That's exactly right. You know, a lot of people are doing that because there's no other cost-effective means to an end to be able to get that coverage. But then I've designed programs with established networks that are specific to seniors to be able to help them navigate and get affordable dental care. It's a passion for me to be able to see, because what a lot of people don't understand is that healthy oral hygiene impacts your physical well-being as well.
Oh my gosh, I'm going to give you an example. I know somebody very close to me who, you know, there are things that happen in people's lives, right? And it's not their fault in any way.
Right.
Things have changed a lot in the last, 10, 15 years already now. And people that maybe weren't able to take care of it, again, there's also people that even have money that don't even want to take care of it because they don't like the dentist, right?
Right.
This situation where they don't even know what to do anymore, and sometimes it's gotten too far. But what I want to ask you is this question that I have. So let's say somebody has, waited to do that, and now they're hearing that you might be able to help them get a dental plan. Will they still be able to, no matter how far it's gotten or whatever?
Yes,
How's that work?
No question about it. It's never too late to be able to try and address it, and oftentimes when it's done, a lot of what could have happened could be prevented.
Right, and even so, if not, at least you might be able to get some help with what's going forward.
Right, and the reality is you just can't help every circumstance in each individual need because it's so unique and far-reaching. But I can, because I've been doing it for 18 years, say, perhaps I've been there and done that and can offer this and give you this suggestion, or tell you what others have done in a similar situation or predicament to be able to help facilitate and get a little bit higher quality of care.
So as I sit here and listen to you, I think about all of the people that call the 800 numbers that are the ones that you see on television or
Yes.
hear on the radio, whatever. But here's what I love about my show the most is that they get to hear the information that they're hearing here. And so when you listen to you, this is the reason why you don't want to call one of those people that are out there that don't know you. You know, look at how far you go with your clients.
I've had 3 people do that here recently and called me and said, Scott, how do I get back? Because what happened was they changed their insurance plan, and now they cannot go to their primary care physician. So now they have to wait until an open enrollment period, which is at the end of the year, before they can actually be in a position to go back to their primary care physician.
Well, every day somebody turns 65, right?
10,000 people a day turn 65 every day.
You know, but you have to start thinking about it. You also want it, right now is a great time to be talking to people about what you need to do. He's an expert at it. He's been doing it for 18 years. But also, what I like is some of the things that even if you've had problems with, he has been able to get in there and really get the job done.
Very much involved in the process.
It sounds like you're very hands-on.
And it could be something simple to something a lot more complicated. But at least if we can look at it, perhaps we can make a suggestion on what can and could be done to be able to help provide a little bit of peace of mind and allow you to be able to focus on getting better.
Talk about being proactive, but make sure that you are really taking care of. The phone number to call him direct, it is 480-331-5244. This is a free service to you. He goes the extra mile, and he makes sure if you're dealing with issues, I love that you brought that up. You can check him out on his website. It's myplancomparison.com. His phone number again, it's 480-331-5244. He's A+ rated with the Better Business Bureau. Statewide is myplancomparison.com.